And we thank you so much for joining us. You are watching The Bronx, Your Voice, Your Vote 2008, the special answering your election questions and dealing with election issues. We're joined by our political contributors Miguel Perez, Bob Nolan, and Marriah Star. Now, before the country found itself in economic turmoil, one of the biggest election issues was health care. 47 million Americans are without health care. Many say this issue should be at the forefront of all political discussions. Here's what you had to say about it.
I will be voting because I'm disabled and I can't get around as much as I used to. But there are a lot of people in the neighborhood that have concerns, especially for health care. And because I'm disabled, a lot of them come up to me and ask me how they can get all the things that I've gotten. And I've told them the benefits, you have to keep on going to the appointments. Because if you miss one appointment, then they kick you out.
And I'm concerned about the health issues in this country, about women who don't have health for, let's say, to get a mammography, something as simple as that.
And do you feel that the economy is kind of overshadowing healthcare? Because
oh, absolutely. With what's going on, absolutely. Everybody's feeling it, but it's overshadowing everything else. That took precedence. It shouldn't have.
And those are just some thoughts that you heard from Bronxites in regards to health care and the economy. The question is, has health care actually trumped has the economy, trumped health care as the major issue of the day? And Bob, I talked to you because early on we talked about the borough of the Bronx, where health care is a major priority. We've got a lot of hospitals, we've got nursing homes, we've got senior services that go on in the borough of the Bronx, and it seems as though the economy has trumped health care, but yet and still a little hand in hand, because if you have if you can't afford health care, you're out there trying to buy prescriptions and things of that nature, and the economy plays forward. Are you satisfied with the way that the candidates have addressed the issue of health care?
They have, but really the economy has overwhelmed health care and every other issue in the last 30 to 45 days. I'm reminded just the other day that when I got my annual flu shot, I sat next to an 82-year-old woman. And while we were talking about different problems, her greatest concern is that she spends $212 a month on health care. And you know, she tries to get the best possible care that she can, but how long can she continue to spend that much money out of her discretionary income to pay for health care? She may have to at some point not go to her doctor because she may have to drop that health care. I'm a two-time cancer survivor, and my last visit to my oncologist, he told me that he knows of patients who are not going for their CAT scans and PET scans because they can't afford it. By the time they come to see the oncologist, it's too late. The cancer has spread too far. And then they wind up in a hospice or in a rest home, and then they die. Why? Because they don't have adequate health care. I think it's got to be one of the first issues that the next president deals with when he takes office on January 20th. If it's not the first, it's got to be among the top couple of issues, because people can't go without health care. They must be able to have it available to them.
And we know that in the Democratic primary particularly, that was a major bone of contention between Hillary Clinton and Barack Obama. Is Barack Obama's health care plan, number one, a pretty short up one? And number two, do you think that we will ever see a day when all Americans will be able to have health care?
I went to my doctor. I'm not going to mention his name. He's a very conservative man, very conservative. He hasn't told me how he's going to vote, but I'm pretty sure he's a Republican and he's going to vote for John McCain. And he shocked me the other day. He said, "You know what we need in this country?" I said, "No, what, doctor, what do we need?" He said, "Socialized health care. Socialism, that's what we need here. We need to socialize healthcare. I'm tired of this." And he started explaining to me, it's not just the people who don't have health insurance. It's the people who do have insurance and have to go back to their insurance company to try to prove to them that they deserve this one test that the doctor asked for. That is what's amazing. The doctor is telling you, you need to have this checkup. And then you go to the insurance, and the insurance turns you down. We have to put an end to that. It's amazing.
I think what we're discovering in this country, and I agree with Miguel, that when you look at insurance and you look at the hospitals and the way our economy works, we must go over to a European-type model. When the government actually provides universal health care, it saves companies money, because then they do not have to pay all the high premiums that insurance companies charge in order to have basic health care for their coverage. The economy actually is core to this argument, because the reason why the economy is in such bad shape right now is because the premiums and the cost of healthcare has risen in the past decade. That's why people have stopped paying off their loans, have stopped paying off their credit. And that is why we have this huge credit crisis now. You fix healthcare, fix everything else.
Talk about socialized healthcare. I had an experience, and it really was an eye-opening experience for me. Took my mother to the doctor. As I took my mother to the doctor, we were sitting around talking, and the doctor was saying, he says, listen, I understand patients have a problem receiving health care insurance, and they're struggling, and they're going through. He said, but I want you to know, we struggle and we go through too, because sometimes here we are and we have to live off of these insurance claims, and sometimes the insurance companies don't even honor our claims, and therefore we can't get paid. They're saying that on both ends, the patient as well as the doctor suffer in the issue of health care. Universal health care package, will it work?
Well, that's the thing. The insurance companies have way too much power. If the Republicans leave healthcare to the marketplace, the insurance companies come in and they use a market leverage to dominate everything, and they end up skewing the entire process toward the rich. You have the rich being able to pay very nice premiums and getting very good health care, and everyone else being left out. We have a system now that is suffering because of that. If the government goes toward socialized medicine, not socialism, but socialized medicine, it will help alleviate the problems that we're talking about.
What does it say for America, though, when you can go to other foreign countries and you can see everybody gets health care, no matter what, and yet and still you come to America, the land of the rich and the free, the place of opportunity, but the one opportunity that you're lacking is an issue of health care.
No, but you do have to look at some of those countries where the free health care is not very good health care too. So, you know, we want quality health care and we want universal health care at the same time. We want everybody to have it, but we want to keep some level of quality there. And some countries don't have that.
And I'm sure we don't want to pay as much for it, as you're saying, because we want to have the best possible health care, but you're absolutely right, because the state budget is hemorrhaging because of the health care cost. On the federal government, it's the same thing. It's costing too much for health care. They need to take a look. Some of the reimbursement rates that you've talked about are too low, and doctors need to be reimbursed for those. When I was going for chemotherapy a couple of years ago, I was taking every 3 weeks a shot to build up red blood cells in my body. And I asked my doctor one day, how much did that shot cost? He said $2,000. It cost me my co-payment of $5 at the time. Now, I'm not saying I should have spent more money, but I probably should spend more money for something like that. But you need to bring a system into place where people are not going to have to struggle so much. They need to be able to get their health care, and they need to be able to get it at a place which is not your local hospital, because our emergency rooms are overflowing. We can't afford to have everybody running to the emergency room. You need to be able to go to a local clinic where they can get that special care and attention just as well, since we're really out of the era where we have people have their own doctors. 30, 40 years ago, everybody knew their doctor was, you went to that doctor. You don't have those doctors with those types of small practices any longer.
Unfortunately, what you have is when you don't have health insurance, the only thing you have to run to is the emergency room.
That's right.
And that's where a lot of numbers go in. Talk about getting through this, because as you have a president with a plan, yet and still we still have two major components. We got the House and and Congress. Are we going to be able to see a president be able to actually get this plan through both the House and
It all starts with, if Barack Obama does win on Tuesday, how much does he win by? It's accepted in American politics that if you win by more than 55%, it's a landslide. So if he's able to win by more than 55%, he will have a landslide. With that landslide will be a mandate. And that would be a mandate to govern for the next 4 years. He'll start to deal with the House and he'll start to deal with the Senate, because they have their own ways, their own ideas about what they think should be done. But in the end, if Obama has a strong enough mandate from the American people, he should be able to get his way with his own Democrats in the House and the Senate.
It also depends on the composition of the House and the Senate after the election, which looks very good for Obama right now, because obviously they're going to have a majority in both houses.
Yes. So I've said this earlier, but there are two numbers to look at here on election night. The first number, as Bob just said, is the margin of victory if Obama should win. If McCain stays fixed at about 42, 43%, that will push Obama's numbers to 55, even 57 or 58%. That would be a landslide. The next number is the turnout. If we get something in the 55 to 60% range, that would be a mandate right there. And the last number to look at is the Senate. The Senate is the critical component of Congress that can stop legislation in its tracks. If the Democrats reach 60 votes, they have cloture, they can pass whatever they want.
Number I got to look at is 0. 0 seconds left in this segment. But we do have to take a break, and when we return, how important is it to exercise your right to vote? Our experts weigh in, but before we go, here's a list of candidates for the judge of the civil court.